nationally recognized sports medicine surgeon who specializes in ACL repair and knee reconstruction. We're going to talk about the Patrick Mahomes injury and what that means. Now, he doesn't treat him, but he's going to give us an insight as all the Rothman doctors do each week. Doc, good morning. Happy holidays, buddy.
Same to you. Bon top. Good to see you.
You got the great. I love him. I want to go hug him. Doc, tell us about what you could foresee an injury like this for next season for Mahomes. There's already talk that, you know what, he probably won't start the season.
So, it was a very interesting Sunday. I watched both those games, Micah Parsons and Mahomes, and it was kind of two variations of the same thing. And if you go back and you watch the film, Micah Parsons had a non-contact injury. And if you watch it, you slow it down, you see he landed, his knee went in, right? So, what happens there is you put a little stretch on your MCL, you load your lateral joint, you start coming forward, and you tear your ACL. Patrick Mahomes is the opposite, and Micah Parsons is probably the more common type of non-contact ACL. So if you slow down the Mahomes tape, you see he lands, but he gets hit from the inside, and his lower leg bone goes towards the outside, right, and not in, which puts stress on his LCL. So basically, you have four major ligaments in your knee. On each side, you have your collateral ligaments, and they're your varus valgus, your side-to-side stabilizers. And then in the center of your knee, you have your cruciate ligaments. Cruciate means cross, like a crucifix, and they cross each other in the center of the knee. The PCL is the stabilizer to posterior translation. It keeps your leg bone from going backwards out from underneath your thigh bone in the simplest terms. The anterior cruciate does the opposite. It keeps your leg bone from coming forward, but also controls rotation. So it's very important if you want to do anything where you stop, start, land, or change direction. In the Mahomes injury, he gets hit from the inside, hyperextends, so he puts a stress on his LCL, right? And from what I've seen, in the news, they said he actually avulsed it, where he pulled the LCL off the bone. That's a more rare injury. Like, people sprain their MCLs all the time. You see the injury report. Those guys go in a brace, an isolated MCL. You go in a brace, rehab. The ligament probably takes about 6 to 8 weeks to heal, but most of those guys are back playing in 3 weeks in a brace. The LCL is different. And the MCL, in most cases, as long as it's a femoral-sided injury, will heal 99% of the time on its own. The LCL is different. It doesn't heal usually without intervention, especially if you avulse the whole ligament. And the other issue is, which is not clear, I haven't seen anything, in the news about it, is it's also associated with the posterior lateral corner, which is a rotational stabilizer of the knee also.
Right.
And so, oftentimes you're not doing just an LCL repair or reconstruction. You have to reconstruct the posterior lateral corner with that. And, LCL isolated is a very rare thing. It's usually in combination with either an ACL, PCL, and oftentimes the posterior lateral corner is involved. So, if it's a straight avulsion of the LCL, you can repair it back to the bone. Oftentimes you'll augment it, or you'll just reconstruct it with a donor tendon. If the posterior lateral corner is injured, you also have to reconstruct that. And that's done with usually a donor tendon too, which complicates the early post-op rehab. Right? You have to kind of guard them a little more. But, if you look at the start of the season, what is that? That's like 9 months, right?
Yeah.
So how long does it take to recover from an ACL reconstruction? I tell my patients there's kind of 3 phases to this. There's the rehab phase of it, where, in the beginning, you're getting your motion back. It takes a couple months. Then you get your strength back. And, you have this surgery 2 weeks later, you come in, your muscles are atrophied, right? These guys are starting at a very different
Right.
position than, you and I, but even though we are great specimens, but, they're starting at a different level, and the next phase is getting your strength back. And then the last phase is getting your coordination back, being able to land, run, cut properly, and getting your sense of your
Especially a guy like
joint back.
Mahomes who does that. That's his game.
Magician, right? So, and then there's biology that has to occur. So you're going to take a tendon, the gold standard for the NFL is to use the patellar tendon graft, right? You're going to put a tendon in the knee. It's got to heal in, and your body's going to make it more like a ligament. That's called remodeling. There's some argument how long that process takes, right? And you can read different things. I think everyone that does a lot of these would agree it takes at least 7 months. Some people will argue a year. I
Wow.
think the sweet spot is, 8 to 9 months, but you have to then go through testing to show that you can perform. And, Anthony, with anything else, with any of these other injuries, there's a mental aspect to trusting your knee
Oh, yeah.
and feeling like you're ready to get back. I mean, these guys are the top 1% of the top 1%. They have, physical attributes and mental fortitude that got them to this level. And I don't think that's an issue. And the other thing is that, if you have this injury, you're still working, right? You're podcasting, right? Your day's occupied with the kids, your wife. These guys have 8 hours of PT a day,
Yeah.
right? And so, the chance for return, I think, is way high. And, the results of this surgery are great. And, just the big thing is the complexity of that lateral side injury, which is not clear right now.
Doc, no one explains it like seriously, you guys are amazing. You guys at Rothman are just do God's work and you explain it great. You got a great bedside manner. I mean, God
Thank you.
bless you. Love talking to you, man. You're terrific. One day I've got to get you guys to come in and hang out.